You are watching the Doctalk show.
So blood clots are becoming an increasing concern in today's society. If you have been involved in some sort of accident, or you have been immobilized, you're not able to move, or you're taking certain drugs that increase the risk of blood clots, you might be at very high risk of getting this very dreadful disease. So I want to understand if this condition of blood clotting is treatable and preventable. So our expert in the studio, Dr. Dungu, will tell us more about this, the treatment of blood clots. So Dr. Dungu, this very dreaded disease, very feared disease, for example, the pulmonary embolism, which goes to the lungs and causes someone to collapse, is that condition treatable, or it is game over for that person?
Blood clots are treatable. And the treatment is, I think, done by anyone who is qualified as a doctor, unless if you get into complications. The treatment usually involves use of blood thinners. We have special medicines that we can use, and usually in the beginning we combine. We can give you an injection together with a pill, and then the doctor will tell you after so many days, we'll do your blood test to see if your blood is thin. Remember, these blood thinners can make your blood too thin, and if it's too thin, you bleed.
And
And
so those are problems of
that's the problem.
reversing it to the other side.
So we need to ensure that balance. And it causes a bit of complication among a few health workers, how to maintain that balance. But the beauty is now we have lab tests that can help us to know if your blood is thin enough. So you won't clot and you won't bleed.
Okay.
We also have medicines now that may not even need monitoring. We have the new anticoagulants, we call them novel anticoagulants. They work in a different way that you are on a fixed dose. You may not need to monitor.
Okay.
But
it also thins the blood.
it thins the blood.
Prevent the clotting.
The challenge is that you cannot monitor to see if you have overdone it. Or if you start bleeding, some of them are not easy to reverse. So all of those will be determined by your attending doctor.
Okay.
The doctor will know which to give. For patients who get a clot in the arteries, for example, sometimes we need to do what we call interventional procedures, where the experts can go in and remove the clot using a balloon so that they open up the flow to conserve the limb. So many times when people have a clot in the artery, we call on the cardiovascular surgeons to come and help us, or the interventional cardiologists to help us see if we can save this limb.
Okay. There are also some interventions, for example, in strokes, if it was due to a very big blood clot. They can do that surgical procedure where they remove the blood clot and restore.
But I can tell you,
blood supply.
those words are easy to see, but practically they are very difficult. And that's why we have to go into prevention. Because, for example, a person has a blood clot in the lungs. Many times they should be in the intensive care unit. We sometimes use what we call clot busters. They'll give you a medicine that will kind of bust the clot, and it all shatters. But you can only do that if you have access to intensive care, because the way it does that, it can cause you bleeding. In terms of prevention, I think we should understand who is at risk of getting a clot. For example, if you or your relative is admitted in a hospital, for any reason, find out if they are at risk and discuss that openly with your doctor.
Because in a hospital admission, if you're given a bed and you're immobilized, it causes you at risk.
We've said globally, 1 in 4 admissions will die of a blood clot.
In the hospitals,
In the hospital.
Of every 4 patients who are admitted, 1 will get a blood clot.
And will die.
And will die.
Yes, the death is 1 in 4.
Okay.
So we need to be sure that we understand who is at risk. If you are pregnant, for example, you know you're at risk of getting clots. You need to keep active. We have to exercise. We have to make sure that if you're given treatment with blood thinners, you take them so that you don't get a recurring
You shouldn't
clot.
keep skipping the drugs.
You don't skip the treatment. You have to be sure you're monitored, because one of the complications of a blood clot is another clot. And if you get more clots, it means we're going to give you blood thinners for your life. Which
the
is
clot keeps coming back.
Keeps coming back.
That's the recurrent blood clot.
We need to be sure that if we're smoking, we stop. Don't reduce, just stop it. To me, I think stopping smoking doesn't kill. Anytime you think I have to stop, you stop. And you're going to reduce on so many risk factors. Of course, we said cancer and other conditions can increase. Now we are promoting cancer screening for early diagnosis so that we're able to make a diagnosis and treat you and cure you.
Are there particular cancers where the risk is much higher, or it is all cancers in general?
Cancer of the prostate, we've seen quite a number. We don't have a lot of publications on this, but we've seen quite a number of people presenting with a blood clot, especially if someone is above 60, they come with a blood clot, and then out of curiosity, say, let me screen you for this. You find the markers for cancer of the prostate are so high up. Cancer of the areas around the liver, the gallbladder, and the pancreas, can also
some of the blood cancers.
And some of the blood cancers can be so much associated with thrombosis. Okay. So we need to look out for all.
So people have to do early screening. They have to go for regular checks with the doctors so they can prevent themselves from getting the blood clots. It might be an early detection that the cancer is starting. So if you can detect the cancer earlier and treat it, we can prevent the problems of blood clotting. Okay, so exercise again comes up.
And we're going to use that word, not exercise alone, but physical activity.
Physical activity.
Because
any form of physical activity.
That going to the gym is the only exercise you can do. You talked about moving from your office to a car, then you stay in traffic, then you reach home, you sit in a chair, watch TV. Then you can't even go and make yourself a cup of tea.
Then in the morning, it's the same cycle. Thing. To the car, to office,
physical
back home,
inactivity causes a lot of problems, including blood clotting. So we need to make sure, even you guys who are traveling, even if you're in business class, you need to make sure you're active. When you're up in the air, move.
Or even in the car when you're going.
When you're traveling up country, find where they sell gonja. You stop.
Even if you're not going to walk out for like 1-2 minutes, so the muscles can pump that blood within the vessels.
And I've seen so many people who say, no, I just traveled from up, I had gone up country, I came back 4 days later, I have a swollen leg. Yeah.
Okay, so how about nutrition? How is nutrition important?
We need to make sure that we reduce on the amount of saturated fats. If you're to eat anything fat, I think if you're to do so, take something liquid. And if it's a liquid, a vegetable oil is better than a non-vegetable oil.
Better than the animal fats.
Yes. So to make sure that we reduce on the amount of bad cholesterol that you have in the system. Okay. And when you eat well, coupled with physical activity, you're going to prevent so many other diseases.
Okay. So thank you very much, Dr. Dungu, for this elaborate discussion on blood clots. You have heard it from the expert in the field. Hematologists study blood diseases, and blood clots are a very, very common disease in today's world. So you've understood how to prevent it. You need to do lots of physical activity. Do not get used to that routine of waking up into your car, to your office, back to your home, into bed. That is going to pose you very many problems, including formation of blood clots. You need to watch your health. You need to go for regular physical checks with the doctors to prevent cancers. All this helps you to prevent developing blood clots. Remember, blood clots are very problematic, a very disastrous illness. It can suddenly occur and may claim your life within a matter of hours or minutes. So you have to take it very seriously, listen to the experts, and take good care of your health. Remember, you can always send in your questions, your comments on the social media platforms on Facebook, on Twitter. If you have missed this show, you can also log online onto our YouTube pages, the Doctalk Show, and catch up with some of the interviews that are uploaded right there. So we thank you again, Dr. Dungu, for taking the time to educate the people, the population of Uganda, and we hope, we believe they have learned a lot from this discussion. So. Are there any last words you want to share with the people?
Well, I think my take-home message is basically for you to know thrombosis.
Or blood clotting.
You should know about blood clotting. You should know that clots are for real, and you should know that it's your right as a person to ask your doctor if you're at risk of a blood clot, especially if you're in the hospital. And for you as a health worker out there, take it as a responsibility, whether you're a hematologist or not, to assess your patients if they are at risk of blood clots. And if you get a blood clot, run to hospital as soon as possible. Or if you suspect a clot, run to hospital as soon as possible so that you can get the attention that you need.
Okay. So thank you very much, Doctor, and we'll see you next time on the Doctalk Show.